you. So according to the AAHA, 2 out of 20% of all cats and 30 to 60% of cats over the age of 10, and as many as 80% of geriatric cats, 15 to 20, have chronic kidney disease. So it's a high percentage of kitties that will get that. I honestly believe the majority, not all, but a big part of kidney disease starts with dry food. And the reason for that is that I'm sure I'm preaching to the choir, but I'm for those of you out there that don't know this, cats originated in the part of the world where there was desert, and there wasn't the availability to get to fresh water all the time. So the way that they absorb their fluid and hydration, the way they get hydration is through the blood of their prey. So we eat food and then we get hydration by drinking water. Cats don't absorb their water that way. They absorb their water through their food, and their water would have been historically blood. So they eat a mouse and they absorb that. A mouse is predominantly blood. They absorb, and so is raw meat. So they absorb the majority of their hydration through the blood of their prey. So even if your cat is I hear so many people, well, my cat eats lots, drinks a lot, he eats dry, but then he goes to the bowl and he drinks. It's not the same. It's not even remotely the same. First of all, if anyone's ever seen a cat's tongue, it looks like a stick with little sharpie things on it to try and pull the water up. But the amount of water that a cat can actually ingest and drink and get into its mouth and down the hatch is very, very, very small in comparison to eating a quarter cup of kibble. The amount of water that they would have to drink to soak that kibble is almost impossible for them to actually drink. So then what happens is they eat their dry food, and then their food, instead of giving moisture, it actually pulls moisture from their body in order to break the dry food down in their system. So it clinically and chronically dehydrates them. So it's my personal opinion that the majority of, there's lots and lots of people that have the same opinion, that the majority of cats that get kidney failure, a big portion of that is feeding really inappropriate food, which is dry food. So everybody out there that's been told that dry food is good to feed and that's what you should be feeding, that's absolutely, in my opinion, hogwash. So what is kidney disease in cats? The kidneys are paramount at filtering the blood and producing urine. Chronic kidney disease is a persistent loss of kidney function over time. This disease can occur over a number of months or years, sort of like hyperthyroid, before failure is evident. Watching for early signs and symptoms is really, really critical, and it really is. So stage 1 of kidney disease and symptoms, frequent urination, excessive drinking, and constipation. Then when we move into stage 2, it would be all of the stage 1, along with loss of appetite and weight loss. Stage 3 and 4 are all of stages 1 and 2, plus chronic bladder infections, cloudy urine, bad breath, mouth ulcers, nausea, vomiting and diarrhea, lethargy, and disinterested. They're just not interested. Please don't forget that every cat's an individual based on their blood work. Your veterinarian will be able to tell you what stage of renal disease or kidney disease your cat's in. So to diagnose it, blood work, this will show what your cat's kidney values are doing. Make sure your request a full geriatric panel with an SDMA. Be sure electrolytes are checked too in case they don't want to do a geri panel. Just make sure that you're getting a full panel, an SDMA, and make sure that all the electrolytes and everything are checked. SDMA is excreted by the kidneys and will show kidney dysfunction earlier than your typical creatinine and BUN results. SDMA tests are more reliable because they can identify if the kidney has had an acute injury or is in chronic kidney failure. So it's a very good test to do that will show signs earlier on. And if your cat has symptoms of kidney disease and it's young, often they won't do an SDMA because they don't feel that it would be relevant because the cat's too young. I don't believe that's true because they can go into kidney failure from having a kidney insult or injury through something toxic that they've eaten that they didn't get really sick on, being exposed to something, some kind of chemical, could be like a malfunction, like something that they were born with. So if they're showing those signs, I would still absolutely, if they're younger, still ask for an SDMA. Urine tests are so important. Often I hear so often, you know, m- my vet did blood work, but it showed kidney disease, but we didn't do, and if I ask what the urine test was, then urine test wasn't done. Often that's because your appointment's like 2 o'clock in the afternoon, so your cat had already gone to the bathroom. So you get there and they feel their bladder and they don't have a bladder. They don't have what they don't have any urine in their bladder, so they can't do a test. Um, when you do a test, it'll show that if there's an active infection. So are they showing these symptoms because they have a urinary tract infection, or are they showing these symptoms because they actually have renal disease? The urine specific gravity this is the part that's really also very important. It will show whether your cat is concentrating, its kidneys are concentrating or the urine, or it's dilute. It will be dilute if the kidneys are not functioning properly. Check blood pressure. The kidneys normally receive about 20% of the circulating blood with each heartbeat. When they're damaged, blood backs up into the arteries, and that can lead to increased blood pressure. And you can do an ultrasound to make sure that to look for any kind of scarring, thickening, or inflammation of the kidneys, and that you would be also ruling out something called pyelonephritis, which is a chronic kidney infection, which I would always try doing if your cat is showing kidney values that are high, but not showing any kind of infection. If it's a fairly young cat, sometimes pyelonephritis won't show an infection in the urine, or it won't, it's already traveled up and gone in to the kidney. So an ultrasound's a really sort of non-invasive procedure that you can rule something like that out if your vet's at all concerned about it. So tips for diagnostics: if it's possible, collect your cat's urine at home the first pee of the day. This way you'll be getting a more accurate concentration. I think that's, from my perspective, when I look at blood work and urine, that's a really important piece for me. Is when was the urine taken? It's the same with us. When we wake up in the morning, our urine won't be as dilute. And if we go and we drink a whole bunch of water and drink our tea and our coffee and then urinate, our urine is more dilute. So you want to try to get it first thing in the morning. The best way to get it from your cat is to ask. I didn't write this in, sorry guys. If you want to write it, or Stephanie, you could maybe put it in the chat. Something called Nosorb, NOSBO, Nosorb, NOS, Nosorb, ORB. Nosorb. And what Nosorb is exactly what it sounds. It's like a kitty litter that doesn't absorb urine. So they can scratch it. You get it from your vet. They can scratch it, and you wash your kitty litter out. You pour some Nosorb into the litter. They go into the litter box. They scratch. They go pee. And then when they come out, you can literally pick up your litter box and pour it back into the container that it came in. and take it right to the vets. And then the vets can just use a sterile syringe and pull it out and check your cat's urine. It's not as accurate for infection because it'll have been in your litter box. And even, we always recommend to disinfect your litter box and then rinse it out and then put the nose orb in. But it still isn't as accurate as a cystocentesis. So even if you're looking for kidney failure in your cat or kidney disease, always try and do the first one with nose orb. No matter what, try to do that. And then if there's any kind of concern that your cat might have a bladder infection, then when you go to the vets, you should ask for them to do a cystocentesis if they can, if your cat has enough urine in its bladder. And it's where they take, it actually isn't as bad as it sounds. They take a very long needle and they insert it into your cat's bladder and pull out the urine, and then that way it's completely sterile, so that if it comes back and it shows some kind of infection, it truly does have an infection. So managing kidney disease in cats, that's one of my cats too. That's Nessie. They'll want to put you on a low phosphorus, low protein prescription kidney diet. They'll also possibly recommend Serenia, which is used for treating vomiting, nausea, and motion sickness. This is what if your cat's in a stage where it's vomiting. Intravenous fluids to help correct dehydration and possible electrolyte imbalance. And then they might be mentioning to you something that your cat should be getting fairly regular, depending how bad the kidney disease is, fairly regular subcutaneous fluids. Now, this is what most conventional management is. So holistic management, this is also Nessie, and yes, he's fat, and I'm sure everybody's looking at me going, "Oh my God, look how fat our cat is!" But there's a story behind Nessie and in vitro in his mama. So that's for another time. But he has got a very unique metabolism for a cat. And we can't talk about that, or else we're going to get into a whole bunch of different cat diseases. So holistic management is, if you can, contact an animal homeopath or a holistic veterinarian. But we're going to go into what you can do yourself, so don't worry. Kidney values are impacted by many factors, including gut health, chronic stress, poor quality diet, chronic dehydration from eating dry food, and more. So in my clinic, our protocol, once a diagnosis of CKD was confirmed or kidney values were abnormal at all, addressed each and every one of these factors. So no matter what, we went through this whole gamut again. So for stage 1 and stage 2, so if your vet has said to you, your cat is in stage 1 or stage 2, slowly removing all dry food if you're on dry food, while introducing a home cooked raw or high quality canned diet, and then rechecking blood work every 4 to 6 weeks to see if the values have improved. So this is diet now. And when I say slowly, I really, really, really mean slowly with cats. If you have a cat that's on dry food and you're transitioning to raw, you really have to do it slow, because cats really shouldn't be at all fasting. And when they do, especially if they're a little bit chubby, they can get something called hepatic lipidosis. So slow introduction definitely wins the race when it comes to introducing raw food or home cooked food into the diets of cats. Probably a lot of people here are going, but I've heard that you're supposed to be on low protein, and oh my gosh, when you put them on a raw food diet, it's all meat, so it's high protein. What I mentioned before about blood versus blood in raw meat, the majority of meat is blood. It's really not high protein. So many dry cat foods are way, way higher protein than a raw food diet. So from a diet perspective, we would do this first. If it was stage 3 and stage 4, we would be reducing phosphorus and adding omega 3s, vitamin B, vitamin C, and vitamin E. Based on blood work, sodium and potassium were sometimes added for electrolyte balance. While we always did our best with diets, and it's really imperative that your cat eats. You may have to try different approaches to find the perfect one for your cat. And what I mean by that is that um, as they progress in kidney disease, you will be managing their nausea and managing their inappetence. So while we want to do our best, it's worse if they don't eat. So I was told once by, I won't mention who it was, but a veterinarian that I respect so much. And this was a long time ago, like 1994. And when we were talking about low protein diets, he said to me, cats are carnivores, they need protein. And when you reduce the protein drastically like that, they don't, they're still cats. They still require that protein. So what they'll often do is their body will then start to ingest their own muscle mass, their own protein out of their own body, which is much more difficult for the kidneys to handle than actual raw meat. So try and remember that as well. But when they're starting to feel, if they do start to, the stages start to, if the stages start to increase, which doesn't always happen. And if it does happen, it can happen gracefully and you don't have to be dealing with something really bad. But the thing you have to remember is sometimes we still have to give them what they'll eat because it really is important. Um, the diet piece of this that I'm talking about and showing, it's been given to me to give to you by my colleague Sarah Griffith, who is an incredible animal nutritionist. So this is her diet, and you guys will be able to get this. I'm not going to go through it all. This is the diet for stage 3 and 4. So recapping diet again, even if your cat's in kidney failure, even if your cat's in renal dysfunction or insufficiency, when it's in stages 1 and 2, we we still would recommend at our clinic a balanced raw food diet and wouldn't go into reducing phosphoruses and all that kind of stuff. But when they are in the later stages, this is a diet that Sarah's put together, and it's a great one. She's been using it for years and years and years. It talks about percentages and grams and how much that it actually makes. So, and what kind of supplements to use. So you'll be able to go back and take a look at that. So supplements, supporting the kidney's best friends, which is the liver and the pancreas. There is no I in team ever. We always have to remember that if one organ or one system of the body starts to fail, everybody else and everything else will do its damnedest to help that body compensate, or that organ or that system compensate and stay healthy. So when your animal or when your cat has renal dysfunction, it's really vital to support the kidneys, the liver, and the pancreas. And when I put together and formulated liver tonic, that was my whole goal, was to make sure that it was for kidneys, for liver, and for pancreas. So no matter what situation your animal was in, whether it has liver disease or it's got pancreatitis or it's got kidney disease, that we're supporting all its best friends to so that they can help the the offended organ and support it as much as they possibly can. Refer to the kidney diet slide for information on amounts of omega-3, B, E, and C, and the Thorn multivitamin that's back in here where it says right at the bottom, multi in cap. It's got vitamin D because vitamin D is really important for cats with kidney disease as well. And the other thing that I do want to touch on super fast is pancreas. Cats have low grade pancreatitis a lot, and it's something that doesn't get mentioned a lot, but we really do. We want to pay attention to cats and their pancreas just as much as we do with dogs, maybe even more. So herbs, specific herbs are vital for cats, and I recommend working with an animal herbal practitioner like our friend and colleague Rita Hogan. She's amazing. Just remember, if you don't work with somebody that really understands herbs and understands cats, many of the herbs that are used for dogs aren't suitable for cats. Cats are sensitive creatures, that's for sure. And herbs and even essential oils and aromatherapy can be amazing for cats, but you have to be careful because some of them aren't good for them. So there's lots on maybe I think we actually have maybe Stephanie can find it and put it in the chat. We have an article with one of our favorite cat vets about aromatherapies. So cellular health, phytoplankton contains anti-aging properties and antioxidants that are incredibly bioavailable and work synergistically to support overall health. So anytime we are looking at chronic disease, we want to make sure that our cells or our animal cells are being fed and getting what they need, and also trying to support the oxidative stress that happens with chronic inflammation and chronic disease. Again, stress reduction, and I would just refer back to the slide with the hyperthyroidism. It's basically the very same thing. This is the cat that's incredibly stressed right at the moment. He's kind of like that all the time. Or he's chasing mice, one of the two. So homeopathy, where do I begin with this? From the very moment there's a possibility of stage 1 kidney disease all the way to end of stage 4, homeopathy is an absolute lifesaver. Stage 1, these are the remedies that we've used, and that is in our protocol. So stage 1 is berberis 12C, phosphorus 30C, given 3 times a day for 1 week, then once a day for 1 week, then once a week ongoing. Stage 2, berberis 30C, phosphorus 200C, and arnica 30C, but you follow the same instructions as above. Stage 3 and 4, berberis 30C, phosphorus 200C, arnica 200C. And if the cat has mouth sores or is vomiting or showing some of the heavier duty later stages of renal disease, then you would add arsenicum 30C and follow the same instructions. So you basically just add arsenicum to the berberis, phosphorus, and arnica. Additionally, if there's lethargy or disinterest that is present with kidney failure, kidney disease, the 2 remedies that we usually go to are phosphoric acid, 200C, should be given 2 times a day for 3 days, and then assess. See if they've got a little more interest, they're a little less lethargic. If there's no improvement, then I would change to Napmure 200C, and we would do that 2 times per day for 3 days, the same as we did with the phos acid. If either the phos acid or the Napmure work, so let's say the phos acid worked, then you should be giving that once a week ongoing. Let's say it didn't work and the Napmure worked, then you should do the same thing. You would use that ongoing once a week. So subcutaneous fluids and future blood work. I gotta tell you about this cat. So this is Nessie again. That literally is a moth. I say it's a butterfly because it's more romantic, but that is a moth on his eyelash, and it was fluttering around. And every time he would blink, it would move around, and it was just unbelievable. I took a video. I wish I could have had the video on there. But it's your typical cat with, instead of it being on its nose, it's only on his eyelash. So there's a number of reasons to keep your cat hydrated. This is so easy and less stressful to do for your kitty at home. I cannot even tell you. So at your veterinarian appointment, your doctor will be able to assess if your cat is dehydrated even before the blood results come back. So if you're going in and you're contemplating that your cat has kidney disease, has kidney disease, your veterinarian will be able to assess whether your cat's dehydrated or not. And it's a pretty easy assessment. They just take the skin on the back of their neck and they lift it and twist it. And depending how quickly it goes back into shape, will tell your veterinarian whether your cat is in a dehydrated state or not. If it is dehydrated, your vet will more than likely, and if he doesn't, I would ask them to give them subcutaneous fluids. But at that time, if you're already contemplating that this could be kidney disease based on symptomatology, I would ask your vet then to teach you how you can do it on your own at home. It is really simple. It's really simple. I know everyone out there watching me can do this on, maybe not on your own. You might need someone to help hold your kitty, but you will be able to do it. Uh, and then that I with cats, you know what? Cats and dogs, but cats even more so. If I can avoid a vet appointment, I do. And the only reason I'm saying that, because it equals stress. And when cats are stressed, a body can't heal when it's in stress, and sometimes they get stressed for a really long time after. So the stress lasts, and the side effect of that stressful time driving there and driving back and having a bunch of stuff done is it's really hard on them. So you do have to have blood work taken and regular routine of going in to be sure that the blood is, that the kidneys are doing what we want them to do. But if we can avoid as many appointments and do the majority of stuff at home with cats, it is so much better. Again, it's really important to have regular blood work done to be sure that the diet and the supplements, the homeopathics, and the sub-Q fluids are moving your cat in the right direction. But so far, everything that I've given you can happen at home until you have to go back for your blood work.